Good morning, everyone. This is Dr. KV Anita, Prosthodontics Department Professor from SRM Dental College, Ramapuram. Today, I will be presenting to you a topic on intraoral scanning in prosthodontics. This is an important advancement in digital dentistry that has transformed the way we record impressions to fabricate dental prostheses. The presentation will be briefly covering the principles, workflow, clinical applications, the advantages, challenges, and recent advancements in intraoral scanning. Prosthodontics has been rapidly shifted from conventional to digital workflows, and one of the most important developments is the use of intraoral scanners, which is called as the IOS. Instead of using regular impression materials, the scanner captures optical impressions directly from the oral cavity and converts them into a three-dimensional digital model. This improves patient comfort, reduces errors, and enhances workflow efficiency. The basic principle is very simple. The scanner projects the light onto the tooth surface. The reflected light is captured by cameras or sensors, and the software then processes this information and reconstructs a three-dimensional virtual model. Imagine taking many photographs while adjusting camera focus little by little. The scanner then checks which image is sharper at different depths and calculates the exact surface. This is the principle behind the confocal microscopy. Now let's look into the triangulation technology. Here the scanner creates a single triangle between the light source, the tooth, and the camera. Based on how the reflected light changes the angle, the distance of the surface is then calculated. The third technology is the active wave front sampling. This technology captures the tooth from many tiny viewpoints very quickly and combines the data into a three-dimensional image. Amongst the three technologies which was described in the previous slide, the most commonly employed one is the confocal microscopy one in the recently available intraoral scanners. Once the scanning is completed, the digital workflow begins. Then we need to see that the intraoral scanning first captures, and then we generate a stereolithographic STL file, a standard tessellation language file, and then a CAD/CAM software is then used to design the processes, and then CAM machine is used for manufacturing, either in the form of milling, which is subtractive manufacturing, or 3D printing, which is in the form of additive manufacturing, and the final prosthesis is delivered. The entire workflow reduces manual laboratory procedures and improves precision. Most modern intraoral scanners today integrate with CAD/CAM systems, virtual articulators, and digital smile design softwares to allow comprehensive digital treatment planning. Therefore, IOS is now applicable across almost all branches of prosthodontic applications, ranging from single crowns, veneers, inlays, onlays, fixed partial dentures, complete dentures, implant crowns, surgical guides, full arch implant prosthesis, digital surveying, and fabrication of even CPD framework. Moving on to the advantages, there is going to be improved marginal accuracy, better occlusal analysis, reduced impression distortion, more patient comfort, better precision, no material wastage or usage, less time consuming, can be repeated several times, and it is easy to communicate with the laboratory.
It's 4 o'clock.
There is reduced gag reflex, easy digital storage and retrieval is possible, and using the same soft copy of the intraoral picture, the dentures can be duplicated several times. The entire process seems to be a streamlined clinical workflow. Moving on to despite several advantages, IOS still has limitations in the form of mobile tissues which are difficult to record, peripheral seal challenging in complete dentures, saliva or moisture affect the scanning process, subgingival margins are difficult to record, the equipment cost is high, and the operator's learning curve does exist, and hence case control and operator expertise remains critical. Recent developments are mainly focused on improving accuracy and digital integration, AI assisted scanning, better full arch accuracy, integration of facial scanners along with CBCT, and dynamic occlusal recording with the help of jaw tracking devices. These are all going to be the future of prosthodontics. To conclude, intraoral scanning has become an indispensable component of contemporary prosthodontics. It enhances precision, improves patient comfort, streamlines the workflow, and supports modern digital dentistry. Although certain limitations still exist, continuous technological advancements are expanding its clinical applications. Thank you for your patient listening.